Hello, classmates and Dr. Bethune. For this week's discussion, I will present basic information on schizophrenia as if I were providing my opinion on treatment options to a group of physicians. Schizophrenia spectrum disorders are some of the most severe mental illnesses that we are aware of, with a variety of difficult symptoms. Positive symptoms include delusions, hallucinations, and disordered behavior and speech. Negative symptoms include reduced overall affect, expressiveness, and motivation. Cognitive deficits are also often present, including decreased ability in executive function, mental processing, and memory. Though not perfectly understood, a few neurotransmitters are known to be involved in the presentation of symptoms and their treatment. Dysregulation of dopamine and hypofunction of NMDA glutamate receptors are thought to be the primary culprits. Serotonin, while not considered to be related to the cause of this disorder, is nonetheless considered to be important in reducing some side effects of antipsychotic medications. Generation antipsychotics are some of the most prescribed medications to help treat schizophrenia. As with most medical interventions, there are pros and cons to utilizing these medications and avoiding them. When taking these antipsychotics, risks include potential side effects and drug interactions, as well as frustration, as finding a specific drug that works for the patient can be a lengthy, arduous process. In addition to general symptom management, the benefits of second-gen medications include being as effective as first-gen medications with fewer side effects and improved treatment of negative and cognitive symptoms. Risks of going without medications include unchecked symptoms and a significantly increased mortality rate, with the only benefit being avoiding potential side effects. With every patient, it is important to perform a benefit-risk analysis to determine what treatment will work best for them. Because different second-gen psychotics work in distinct ways, success depends on pairing the right medication with the patient. While complete recovery from schizophrenia is rare, around 70% of patients with this illness can significantly manage their symptoms with long-term medication. However, side effects of these medications can make it difficult to follow a consistent treatment plan. These include extrapyramidal symptoms and attardive dyskinesia, though at a lower rate than first-generation antipsychotics. Metabolic syndrome, sedation, and cardiovascular issues can also be common, in addition to a variety of other specific issues associated with certain medications. Very few directly increase mortality rates, as most of them have been shown to reduce mortality by 40 to 50%. As more people turn to artificial intelligence to do their research for them, it is important to verify the answers produced by large language models. For example, when asked about schizophrenia, ChatGPT gave answers generally consistent with what is included in the textbook. It correctly identified the neurotransmitters involved and correctly listed several second-generation antipsychotics that could be used for potential treatment. However, ChatGPT provided many specific statistics regarding the efficacy of certain treatments that the text did not. And when I prompted it to provide the sources it used, ChatGPT replied that it did not have any specific sources for those numbers. This is concerning because it is difficult to verify its claims. Additionally, while it listed various drugs as potential treatments, it did not mention the significant harm of taking a drug that is not right for the patient. Forming a relationship with a provider and heeding their medical advice is crucial to minimizing risks that the AI model cannot foresee. My recommendation for treatment would be for the patient to consult a medical professional to determine which second-generation antipsychotic would be best for them, or if other treatment options would be better. With proper medication, patients could expect reduced symptoms, improved life expectancy, and increased social and occupational security. Without medication, symptoms could run unchecked, reducing quality of life and increasing the risk of suicide, substance abuse, poor health habits, and institutionalization. While utilizing AI can help with general questions, weighing the pros and cons with a professional is important in developing a lasting treatment plan. Thank you for listening to my little presentation. I'll move on to my references now, so you can take a close look at them, or a quick look at them. All right, thank you again.